The NMC CBT is changing, and if you're an international nurse who would like to work in the UK, then you're in the right place. Perhaps you just 1 or 2 steps away from UK registration and need guidance to get over the CBT hurdle. Or maybe you're overseas and need reliable online preparation to help you through. Well, worry no more. We're here for you. Here at IELTS Medical, we have books, courses and lots of resources to see you through to a first-time pass of the NMC's computer-based test. In fact, in 2017 to 2019, 100% of the nurses we trained for the CBT passed, and we'd like to see you through too. Inquire today about our new NMC CBT books and online or in-person courses for the new version of the CBT.
Right there, Manong George here again, and today we have very special guests.
My name is Joyce. I'm a registered nurse working in Guy's and St. Thomas in London, and currently I am recovering from being positive for COVID.
Hi everyone, my name is Vaughn, and I'm a nurse, a private ICU nurse here in central London. I am on my day 15 of isolation and I had COVID-19. So yeah, recovering.
Right. So the aim today, to all our viewers, is just to show a different side of COVID as well. Because obviously we've seen COVID in a lot of probably negative light. And yes, we've seen some positivities there as well, but I just want to introduce you to some people who've had it firsthand and have recovered, and they are frontliners, so they can't really get away from this. But we'll get to the nitty-gritty of it. We'll ask them how did they feel and what are your symptoms. So again, let's start with Joyce.
First of all, before everything started, I was already very anxious because by background, I work in theatres, and having to be pulled out and to work in intensive care was already scary. So when I already got ready to work that morning, and something just didn't feel right. I was coughing constantly, and as I'm trying to eat, I lost my sense of smell and taste. So that was sort of what alerted me, because at this point I was still in denial. I'm like, I'm not, I was confused and very unsure. Like, I can't have it, blah, blah, blah. So that alerted me a little bit. So I just decided to isolate. And then, just the coughing just got worse and worse. I was losing my appetite. I just couldn't taste it. And then over time as well, I was getting a lot of aches and pains, muscle pains.
Right.
And it wasn't all at once. It just developed. It just kept getting worse. And then I was very fatigued. I found myself at the worst, those, I would say even 5-6 days, I was sleeping a lot. I was just very tired. And then as well, with the thing that scared me the most, I think, really was the breathing. I don't suffer from any other conditions, but I was getting very tight-chested, causing me to again get even more tired. And then from that, I was getting more anxious, palpitations, shortness of breath. So I found I was in bed a lot, and so those were really my symptoms. The one thing I didn't get was a fever. I was waiting for that to kick in to sort of validate, like this must be it, but I didn't get a fever. I could sense my temperature rising, but it wasn't in the criteria as to, like, depending, the policy in my hospital would say, you have it, but I felt my symptoms were strange enough and new to me that I had to take precautions.
I see.
So that was my experience.
Right. So how about you, Vaughn? What was your experience, though? What was your symptoms to start with?
Actually, my symptoms are quite different from Joyce, because I think I don't have that typical presentation of COVID. Like they said, you have to have fever, cough, sore throat. I didn't have any of those. The first thing I felt was it's more of a back pain. lower back pain, and then it gradually increased to more of the generalized body pain. And then day 4 comes, I started to have like stuffy nose, not really that runny, but it's stuffy. And then I lost my sense of taste and smell, and up until now it's quite still faint. The back pain stayed up until maybe on the 5th and 6th day. And then there was also a time, I think the worst day for me was day 5, 6, 7, and 8, I think, because those days I felt a little bit congested on like my breathing, but there's nothing coming out. So it's more more minor in terms of respiratory symptoms if you compare it on the template of the government saying you should have fever. I didn't have fever. I didn't have sore throat. I didn't have cough. So it's really, really different from others as well. So yeah.
Wow. Yes. I mean, this is the first time actually for me to hear, that somebody who's had COVID didn't have fever. Because again, this is the information that has been going out there. Fever is one of the most classic signs. But eventually, though, how was it confirmed? Joyce, did you get your confirmation from your trust? Or did you have a swab? How did it happen?
So for my trust, they were offering swabs, yes, one in on site, but also they were offering people to go to the drive-through at the O2. But I chose to do it on site. So it was throat and nose swab. And to find if you were positive, they would call you within 48 hours. If it was negative, they would send a text. I think it was like that for the majority of the people I know. So I was thinking I wasn't going to get a phone call, but I did after about within those, so about after a day and a half. So yeah, it was occupational health saying that I was positive, and then they were telling me instructions. At that time, it's funny with COVID because I thought I was improving. This was day 5 or 6 of my symptoms, and I thought, okay. And on the policy and on the government website, they say, after a week, you can go back to work. But I thought I was getting better, but the symptoms kept coming back. The doctor said that feel free to work if you feel okay. But I was just like, I woke up the next 2 days and I'm like, I'm struggling to breathe again, and I'm like, I can't imagine working in this, feeling this way. So at the moment I'm on day nearly 2 weeks now. So I've just, because they gave us an option, luckily, that they, if you only work if you're feeling really like you can work. Of course. Because it's such a busy environment. So I've just told my workplace that I'm going to take another week off just to be sure. Because they don't offer a re-swab. So that's sort of my experience.
Just to let viewers know, I've met Joyce for how many years now? I think when I first came to the UK, I've seen you grown from a young lady. Now you're literally dalaga ka na. But Joyce has got more energy usually than this, and I can see that she's got a bit of a struggle there. So I could just imagine you trying to work such a busy environment. It will be a struggle. And I suppose, Vaughn, what would have been your story? How did you get your tests done?
There is no specific days on how or when will you be swabbed, because I think there was no clear policy in place on that time when I was swabbed. But with regards to my case, I had been swabbed 5 days after my exposure. I have been swabbed twice. Since I had been exposed first to unprotectedly exposed. I had been swabbed 5 days after that first exposure, but I didn't
Mm-hmm.
have any symptoms. Now, the succeeding days, I've been taking care of COVID patients, and I felt a little body malaise or mild body malaise and or
Yeah.
body weakness. That's the time I requested for the second swab. That is a week after the first swab, which is negative. Now after a week, I got the positive result. So it was
Mm.
also 5 days after the exposure, the second day. I mean the second exposure. So
Right.
I made sure that there have been like 5 days in between. I don't know if there are protocols to do that, but I was just thinking that if I do it too early, it might be false negative.
Yes.
So yeah, that was just the case for me.
Yeah,
But
and
yeah,
I think that's in some other cases there have been like false positive results which
yeah,
might lead to, obviously you being asked to work further,
yeah,
and then I've heard stories of nurses not really well and having to work, and only for them to later on find out that they actually are COVID positive. So it's very good that your stories tell a different, not a different story, but a slightly different case wherein both of you didn't really have fever to start with, and although some of the classic presentations are there, like the um, loss of taste and smell, this wasn't really identified
yeah,
until maybe on the second week, you know, of COVID being in the UK. So it's quite
yeah.
that's really
I think
informative.
there's still debates on that if they would include loss of taste and smell on the classic presentation of COVID, because some research are still ongoing about that one.
Hmm.
They still stick on to fever, sore throat, and cough as the
Yeah,
main classic signs. But there are some signs that hasn't been felt by those COVID positive
exactly.
like us with the mild symptoms, and maybe you would say 80% of those infected are only suffering from mild symptoms and not all suffered from fever and
Yes,
those stuff.
that's
Yeah.
very true. Let's talk about your journey to recovery. Both of you have mentioned about having to day 5. Um, can both of you tell me what was the most difficult and how did you cope? Who helped you and what kept you going? Because, this is the hardest part, really. After that day 5, once it starts speaking up, you know, it's very hard, I suppose. And I know both of you would have very different situations.
Mm-hmm.
So again, let's start with you, Joyce. How did you cope?
So it was I didn't find it as, because I was scared too that I would really deteriorate. But luckily I could manage myself. Um, but it wasn't fun, the fact that I couldn't eat properly. I
Hmm.
found that really difficult because
Of
I love
course.
to eat. I think we all
Yes.
do.
Yeah.
And the breathing was something I've never really experienced before. So really what bothered me more was my anxiety and
Mm.
being indoors and just staying in my room. Until now, I haven't even been outside or
Yeah.
whatever. So yeah, and just feeling like someone is like constantly standing on your chest.
Oh no. Yeah.
I was really, really like wondering like, oh my goodness, is this ever gonna get worse? Um, but I think trying to be positive, no matter
Yes.
how, and trying to just relax and rest. Everyone would send me really encouraging messages, family, friends, and just making sure that I relax and rest. Because I mean, in my career so far, which hasn't been that long, I haven't taken more than a day of sick. So this
Mm.
was really strange,
Yes.
being just being forced to rest and just stay put basically. Um physically I was getting bored.
Yeah.
But yes, I took the usual advice, like stay hydrated, taking, the paracetamol for the pain. And my family has been really good in supporting me, always checking up on me. Um, and I think during that time that I was really, really bad. I mean,
Hmm.
I come from a religious background, so it was Holy Week. So a lot of
Yeah.
praying,
Yeah,
a lot of praying and just being hopeful, I think also helped me.
of course.
Yeah, and just trying to relax, and there might be a reason as to why I've been forced to rest in this way, and just focusing on myself. I think that was
Yes.
a little bit of me time as well, as much as I want to
True.
go out and help. Yeah.
Yes. Great. How about you, Vaughn? What was the hardest part, and
I,
how was the road to recovery for you?
yeah, I think it's quite different for me because as an overseas Filipino nurse, your family is not here, your support system is not physically here. Knowing the fact that they are also aware and so anxious about your condition there, it adds pressure on your recovery. But I am so feeling blessed because my support system here in the UK and back in the Philippines, they are all overwhelming. I have two lovely housemates who've been supportive on my recovery, but unfortunately, two of them now has symptoms. I am on the road to recovery, but they both have symptoms now. One apparently has tested positive, and one is still awaiting for the swab result. So it's kind of ambivalent that I am quite well now, but they are feeling
Hmm.
sick. But that's what we do now. Um, we just help out each other, and with the help of our friends outside as well, and our individual family members back in the Philippines. I think the most difficult for me was yeah, like what Joy said, is to be confined in your own room, not
Hmm.
really doing anything. Like you can't even just do the normal things you usually do in a daily basis. But with the help of your maybe my housemates and my families, they've been boosting my mental health, because this is not just a physical
That's
issue. This
true.
is also taking a toll on your mental health. So yeah, I think support system is really important for COVID patients, especially are on isolation.
Yes, I mean that's very hard. I just suppose. Yeah, it's something that I'm also dreading because me, I'm working from home, not doing much, but it's already quite a struggle. But to double that up with a disease that we just don't
Mm-hmm.
know much about, I guess that makes it incredibly, incredibly hard. But and a silver lining, I guess it's great that both of you have been, has improved greatly now, and hopefully on the way to full recovery. But the fight for this is still not yet over, as you mentioned with
That's
your
true.
case, Vaughn. You've got your housemates now. Maybe you, Joyce, have to come back to work soon, and then you'd see it out again. But this is the life of nurses, isn't it? This is what we
Yeah.
do. We don't back out from this sort of things. But I've had some messages, personal messages from other nurses saying, they feel down about their situation. Some find it like a stigma. I've even met somebody who mentioned to me, please, George, don't spread it out there because actually my family back at home in the Philippines doesn't even know about it. So,
Mm-hmm.
what would be your message to our nurses here in the UK and maybe even the Philippines fighting the COVID-19? Literally, if they have it, what are your suggestions, your insights, or maybe even, your advice to them? Let's start with you, Joyce.
Um, I think as nurses, I think we're so busy on putting others first and looking after others. We're constantly thinking of other people. It's our duty, it's our job, it's become us. So I think look after yourself.
Mhm.
Um, from what I've experienced, if you start to feel symptoms, many of us will be in doubt, in denial, I think. But I think it's to actually, but definitely take precaution as soon as you feel something. Just because you never know what can happen. And so, yeah, just follow the rules, I think.
Yes.
If you feel something, just, no one's going to judge you. No one is going to, if that happens, I think more people will be thinking of you as well. So look after yourself. Also, many of us will have other fellow nurses who are close friends, family, look after each other. Um, especially if there are still, like with my close friends who are working on there right now on the floor. You give them words of encouragement, look after each other, because like um uh one was saying, this is also affecting our mental health.
Mm-hmm.
And for us who have been affected, but also for those who are currently working. um and like I said earlier, I think find that source of strength somewhere if you're
Mhm.
sat at home in your room, whether it be with your family, friends. Luckily, we live in a time where everything is online.
That's true.
Um, for me, FaceTime has helped a lot. Zoom has helped a lot. Um, like I said, prayers, and yeah, find that your own source of strength and hope.
That's great. That's great advice. How about you, Vaughn? Anything you'd like to add to that? What would be your suggestion, advice to other nurses?
Is it me? So I think in terms of support for nurses, this is the time that we support the not only nurses but all the frontliners, all the healthcare workers who fight for their life and fight for your life in terms of this pandemic. Let's pray for them. Let's pray for their family, because at the end of the day, unlike any other job, that at the end of the day you finish your job, you have your own, you can deal with your family in a separate manner. But here, even if we finish our job, we bring this stigma, this anxiety, this risk to the family and to the household. So it's not that easy. Although even we wash ourselves up, there is still that anxiety in you that you might be sick, you might have gotten the disease already, or you might have been infected that you didn't know, and you didn't want to pass it to your household or to your family member, and that is more painful than the physical symptoms itself. So I would just like to tell the nurses to be brave, don't lose the hope. I mean, don't lose hope. Stay strong on it. Have faith. Prayers only. If you feel uncomfortable, verbalize it. I mean, tell it. Speak out. If you think that the your practice is quite what do you call that, risky, challenge it. Escalate it to the proper authority so that they would know what things you need for you to carry out your job. So I think this is the time that we look after for everyone, and at the same time support everyone mentally and physically.
That's great advice, one. Well, I'd just like to say thank you to the both of you. Not only thank you because you joined me today, you gave up a bit of your time while you're still recovering, but also I want to thank you for, I know you're doing a great job out there. You're real frontline nurses who, like you said, one, risk your lives day in, day out. But I just want to say, like, from me and my family as well, we're very thankful of you, and you're always included in our prayers. And I hope that all of us can join our hands together and make sure that we can come out of this better and stronger.
Um, and don't forget, always remember, Manong knows.
So always stay safe and don't forget Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.